Mr. Karamjit Singh CBE. He has been the chairman of our trust since 2014. We have a unique faculty. I started in Leicester as a consultant. I moved from North Wales here at the same time as him. He has got considerable knowledge of diverse communities. That is the key in the Midlands. And Leicester Community Relations Council, he worked as a community worker before he took over the most prestigious post of our trust. He is committed to the highest quality experience, and he has done a lot with regards to the patient safety. He is first chair of Coventry and Warwickshire Partnership NHS Trust. Before that, he is a board member. He was a board member of Coventry Family Services Health Authority. He was in Coventry Health Authority. He was a trustee of British Lung Foundation. So many prestigious things. If I keep talking, it will be all day I have to talk about him. Not only that, he's a trustee of a local Sikh temple in Coventry and Warwickshire area, council member of Justice, which promotes research and advocacy. He's elected for the National Board of NHS Provider. That's a real prestige for Leicester, for all of us. He's given CBE. He was awarded CBE in 2000 for his services to administration of justice. He is one of the 100 top BAME leaders as per the Green Park survey, national survey. He belongs to companies of Chartered Institute Management. He's a fellow of Royal Society of Art. And we are really proud to welcome you, Mr. Singh, to release our book. I'll stop this sharing the screen. Hopefully, I'll try to spotlight Mr. Singh here so that you can all see him. Thanks for blessing us with your presence, Mr. Singh. Thank you.
Okay, well, thank you very much. Can you hear me?
Yes, it's clear. I can see you very well. Thank you.
Yeah. Well, firstly, let me say that obviously it'll be very obvious in your introduction that I'm not a clinician, so I have to give you that health warning that I'm just an ordinary member of the public. But I have a son who's a doctor, so I understand very much these issues. I must say that reading and obviously just dipping in and reading parts of chronic pain management, reading the book that Dr. Vasu and Dr. Kodi Valasa, who are colleagues here at University Hospital of Leicester, and Dr. Balasubramanian here at University Hospitals Coventry, which is where I live, and Dr. Ingle at University Hospitals of North Midlands, and obviously all their other colleagues who've helped them. I mean, I think it's a fantastic book because pain management, and I look at these issues as a layperson in terms of what we need to be doing and thinking about is putting the patient at the center of our concerns. And I was really struck just listening to both Alifia and Sandeep just before me talking about this. And this is really important. But I just want to say that in terms of, before I come back to what they were saying, I think that as a layperson, when you think of pain, you think about the physiology and what people tell you. You think about their emotions and their behaviors, but also the point about the environment, the stress and the other issues that have been mentioned. And I think that reading the book, I mean, I must say, I find it really informative thinking about, as a layperson, thinking about the cohorts of patients that are affected, the different cohorts, the pharmacology, the national guidelines, the different parts of the body and the different conditions. And it's a really comprehensive book. And I'm sure it'll be very successful globally, as an aid to both practitioners and people who are reading it. I find it really easy to read. This is a layperson going through it. I want to take this further because I think that when you think that something like 30% or so of the population has chronic pain management, I think that the points that the two previous speakers were making are really important. At the moment, the NHS is beginning to put a lot of emphasis on integrated care systems. And integrated care systems are all about, or should be about, making life better for patients. And I think that what that means is we must be looking at something like pain management actually crosses the boundaries between primary care, mental health and community services, and acute services. And what we should be looking at is actually the pathways and actually, are we providing the best care possible? Now, if you aren't aware of it, yesterday, the board meeting of NHSEI has actually brought out and took some major decisions about integrated care systems. For example, it is actually abolishing CCGs over the next year, 18 months as commissioners, and you need to be reading about that, and you need to be thinking, what are the implications for services such as ours? The demand on clinicians at all levels will be to rethink their services so that they are both more efficient, they are more timely for patients, and actually you're able to produce a better service. And that's what I believe all of us, and my role and the board's role in my trust and everywhere else, is to really make life better for the patients. We should all be patient focused. And I've always believed the NHS is about people. It's about the people we serve, and it's about the people who provide that service. And that is yourselves. And again, I want to commend this book by Dr. Vasu and colleagues. And I have to say that obviously, from my perspective, it gives me great pleasure because, we are a university teaching hospital. We're a teaching hospital. And actually, it's really important that we stress that. And I think that it is really humbling that amongst all the busy work that you do, that you find the time to do this. I mean, I say this because I'm an author as well, but my book is not a clinical book. It was writing the autobiography of my father. My father came from India in 1938, and so I have a different kind of life experience, although I go back to India regularly, and I still live in the village house my great-grandfather built in 1940. So I have my sense of my roots there, as it were. But I think what's really important, and coming back to the main topic, is that something like chronic pain management, I think, as a layperson, covers all the different parts of the NHS. And if I may say so, I think that this is absolutely the sort of issue which, I hope that you come together as clinicians and actually someone will perhaps start writing about how the existing service models can be changed to provide a better service. And if there's anything we can do from UHL's perspective that can help in that, we'd be only happy to do so. Thank you.
Thank you, Mr. Singh. That was a great motivating talk. Thanks for all your blessings and your support. Thanks for releasing the book and supporting us. It's a very big part from you. Thank you very much. I know it's so busy in the UHL as well as
that's fine. It's my pleasure, actually. It's my pleasure. And